Hi,
Welcome,
Don.
welcome.
Hi,
Sir,
Don.
join in. Go.
Alyssa, it makes me want to break out my walking pad, but I just can't do it. I can't do it.
Sorry. I am actually like podcasting the rest of the day and I have to sit so still that these are meetings I like cherish where I can just walk.
Love it.
See, I'm so uncoordinated that you would see me and then I would just disappear because I would just fall off somewhere. I'd be featured on one of those TikTok videos. The person just
Dawn, I
drops.
have a very embarrassing story for you while we're waiting. Where one time in a meeting with our team, I was walking. I walk during all of our internal meetings usually, and I just looked away, and I don't have great body awareness, and I like turned away and then fully ate it and ended up with a bloody toe, all from just turning away from a minute while walking on a walking pad. So, right there with you, sister.
Yes, my family and proprioception are not aligned.
Same, same.
It did make me stand up though, so thanks for that.
I'll give folks a few more minutes. Oh, there's Janet. Hi, Janet. I thought you weren't here yet. But I do know I anticipate this to be an information-packed meeting, lots to talk about, lots of activities to hear and absorb, and hopefully some time for questions. I'd also like to, did we introduce Mandy last? I
You
can't
did.
remember the last.
I introduced her via email, but would love you
Oh,
to
okay.
do so in person, Dawn. Thanks.
Yes, Mandy, can you say it? Mandy is now the co-chair of ELD. She's our private, I can't remember who's public, who's private. She's our private member. So Mandy, do you want to give a very brief intro of yourself?
Sure, I would love to. Yeah, hi everybody. I see some familiar faces and some new faces, which I love. So I'm Mandy Menard. I am joining on, and Anna and Don have been so gracious in supporting me in this transition as I get my sea legs under me and joining as co-chair. But have been, in the field and around the field of early childhood education for about 20 years now. Plus, and so I'm currently with Vermont AUIC in career advancement as a program manager, but really very interested and excited to join this group of people at this particular time because there is so much happening. And I am just really looking forward to hitting the ground running and to experiencing these meetings and moving towards the goals of the committee with the whole crew. So thank you so much, Don and Anna, and thanks for everybody for having me.
Thank you. So with the new year, we got word on December 30th that we were awarded the PDG. It was very exciting, but it also means there's going to be quite a bit of work needed as this is a one-year grant. So at this point, I'm going to turn it over to Morgan and Janet to talk about this came together very quickly in November. So this was a very whirlwind experience. So Morgan and Janet, take it away.
Sure. Hi, all. Happy to be here. I haven't seen so many of you actually in quite a while, so it's good to see you. I'm looking at you, Jen Severance, and others that I haven't seen in quite a while. So, for anyone I haven't met, Morgan Crossman, I'm the executive director of Building Bright Futures, and am co-leading this grant application with the Child Development Division, the Agency of Education, the Department of Mental Health, and the Department of Health. And just to give a little bit of background on the previous iterations of PDG, Vermont has consistently been on the forefront of receiving PDG applications. We've had these grants, early childhood systems building grants, over the last 10 years. And they've made such a significant impact in the system. The most recent iteration that we had was a $23 million grant over the course of 3 years that the Child Development Division has been overseeing. It was such an impactful grant for almost every single person on this call, but also kids and families across the state, because not only was it a systems building grant, it was also a direct service, get money out the door to programs and communities who are doing this work. And so when I think about the last 3 years and what we are wrapping up right now in getting money out the door to communities who are doing such incredible work, having come off of COVID and being agile to the needs of whatever is coming at us federally, this grant has been such an important dollar amount and influx of funding and support for partners across the system. That grant ended December 30th with a liquidation period, and we also received a very short, no-cost extension last minute. So as you can imagine, the federal administration has made it really easy for us to both expend those dollars and be able to move the funding quickly and to know if we were going to have funding throughout the course of this grant. In terms of this next iteration of the preschool development grant, we had been anticipating writing that grant last year. So it was supposed to drop last February. It didn't drop until the week before Thanksgiving, and they said you have till December 1st to write it. So my very quick gratitude for everyone who dropped everything for a 2-week period, probably more like 7 days, from every agency, department, division, the governor's office, private and community partners. So many folks stepped in to help us both pull the application together, give us the right input that we needed quickly to be able to write the application. So we did submit for about $12.9 million. The max was for $15 million for each state. This was a really competitive application round. So we did not actually anticipate receiving this funding, especially given so many of the restrictions and the nature of the quick turnaround. We were among so many incredible states who still didn't receive the grant. And I'm thinking about colleagues in Colorado and other places who, again, we have been partnering with and working, towards similar goals. So feel incredibly lucky to have received this most recent round of funding. We were awarded, I believe, $12.7 million as a state for 1 year, which is, I believe, the highest amount we've received in 1 year since the grant, since the preschool development grant series started. Usually we're around between 4 and 8 million a year. So what's amazing is we now have a little over $12 million as we also finish out the most recent preschool development grant. And this one's different. So I want to make sure that folks understand some of the kind of key differences between the most recent 3-year award and now this very quick 1-year award that we received. The first thing is that it is not a direct service grant. Did we still do our best to ensure that we could put specific money out the door to communities based on the needs and what we found in previous years? Yes. But this is not the same where we have 9 million or X number of dollars that is absolutely directed to community-based programs doing the work. The second is previous iterations of this grant were about the early childhood system as a whole. Please include everything. We want to see you go prenatal through age 8 and think about the holistic system. This one was way more targeted on early childhood education. And that system of services, namely childcare, pre-K, and Head Start. And there was such an intentional focus on how we integrate as a state with Head Start and think about that body of work differently as a state. So I think those, just in terms of big picture, are some of the key pieces about the application that is very different from previous rounds. Janet, what else would you give in terms of kind of big picture overview on this one?
I think you got it. Quick turn. It was quick. So that's, that relative to the extent to which the reason we were prepared to do this work is because of all of the work that had been prepared to submit a competitive application, is because a lot of the work that had already been done in terms of creating the strategic plan, identifying the priorities, like the conversations that happen in this group and in other spaces had us be ready to say, here are the projects that we could hit go on in a 12-month period of time. And I was really excited that there was an incredible focus on creating a coherent early childhood education system within the state. There was a lot of focus on the RFP was really focused on and that included sort of technology systems and supports and business services and support. So it was work that we had already like had top of mind in Vermont but were needed funding for. So
Yeah. The last thing I would offer overall is that this one I'm most proud of. Of any of the grants that we've written in the last 6.5 years, this one it feels like the right moment in time to do this work based on all of the work we've done. So this was not we're throwing everything into this grant and let's try to do it all in a 1 year period. It was, what do we know based on the vision and strategy we've set as the system? What were the lessons learned in the most recent preschool development grant, and what are the existing gaps we have, and what are the next steps that we already have identified that we need to take? And that's what's prioritized here in a really meaningful way. And we're going to walk you through the new 3 key elements. So the previous grant had, here are the 5 big projects and things that you need to do, and then we built 18 under it. That's not the same type of grant this time. There are 3 key elements. So we'll walk you through a little bit of what's in those. Go ahead, Matt.
Yeah, I know you want to get to the rest of the content, but just a quick question to follow up on something you just said. It's interesting and congratulations to everyone. It's such wonderful work. So appreciated. I'm curious how it is that this administration that is so critical or skeptical about Head Start, is there anything, maybe it's not worth talking about, but it seems curious that there would be this ask for there to be that integration when it seems like the underlying messages from the federal government are negative in that way. Again, if this is something to talk about later, I'm happy to take it offline, but just curious observation.
So I know Renee is not on the call. Janet, if you want to start, I'm happy to weigh in too.
I actually think that leadership within the Agency for Children and Families, or the Administration for Children and Families at the federal level, has a lot of experience with Head Start. And so, right, it was a brand new administration when the budget conversations were happening, right, last spring, which felt like Head Start was under threat. But my sense is that once some of the other appointees got put into place, I think that they had some deep experience with Head Start. And again, that's where, and it came through as like, well, I think the theory is a little bit of like, there's a lot of Head Start if Head Start is a gold standard, why are we not using what the lessons are and the resources are of Head Start in developing our system? And many other states, I mean, bigger states, like it's like they never talk to each other, like Head Start and childcare. And so anyway, so that's what they were trying to push for, I think, is my guess, or but I feel like I've heard from others and my consolidation of that, what they know.
Yeah, I would have said the same, Janet, that I think that our partners at the key experts in the administration that work closely with the preschool development grant have expertise and understand the importance. They really tried, I think, to simplify and streamline this application. It was still incredibly difficult to write, but it really was more focused than some of the others that we had seen. So I think that I think it was a really important opportunity for us as a state, given how much has been happening federally with Head Start and the challenges our partners have faced, to bring, Renee into that conversation. And she has been so phenomenal in helping write and strategize the preschool development grant every round, but to actually see the intentional call out and ways that we could integrate Head Start in a more intentional way it was awesome. All right. So let's talk a little bit about the things we are legally required to do, and then all of the other things that we want to be doing that we will do. So there are three different components. They're calling them critical elements. And this grant, while I said is so different than previous rounds, it still tracks in terms of the topics and big picture things you're required to do. So every round of PDG has said, do a needs assessment and update or implement your strategic plan. So the first critical element is needs assessment and strategic plan. What was amazing under the first or the last 3-year grant that we received is that we overhauled our needs assessment. So instead of every single year or every single time the feds come to us and say, do a new needs assessment that takes a ton of capacity and time, and everyone on this call, we said we're going to do it differently. And so our team developed a meta-analysis strategy and a new infrastructure that on an annual basis, we're able to pull from both the Building Bright Futures network and all of the experts that you all are in the system to say, here are the needs of kids and families. And there's that continuous identification of needs. But we also are able to now really efficiently pull from every other needs assessment that's being produced related to kids and families and doing that thematic analysis to update it and say, all right, these are still the longstanding needs. Here's some new emerging things that are happening. So that's been really exciting to transition from, okay, now we have to do another needs assessment that is duplicative with insert 4 others that are asking people the same questions. So that's really exciting. And really using that identification of needs, transitioning it into the data portal, and a data dashboard, as well as things like State of Vermont's Children. In terms of the strategic plan, again, key activity in the previous round, it's funny because I'm coming into this year so proud of that body of work and being able to use it for this body of work. We now have a 5-year strategic plan and vision for the system that has full sign off from the governor's office all the way, across the state that says this is the vision and the strategy we're moving towards. And we are now able to move into a different phase of how are we getting people to understand how to use this document, how we state agencies or in communities can be using it and pointing to it, and how are we actually monitoring the change and the process of what's happening in our system. So a lot of work in this next year to develop some new systems on both training and coaching people how to use this strategic plan and how it maps to policy recommendations, how we're monitoring and identifying what we need to measure and know about, and working with you all on what that implementation actually looks like. So that's the whole first bucket. The second critical element is broken into 3 categories, and Janet's going to tackle a lot of these because most of this is in that childcare pre-K space. But the first, as she mentioned earlier, is essentially building comprehensive systems. How are we unifying all of the different elements to build a coherent early childhood education system? Want to talk about a couple of those?
Yes. Okay. And actually, just one second, because I wanted to say there were also, anyway, the way the grant was that RFP was written was a little funky, but it did say it had these 3 critical elements, but it also had some core priorities. And I don't think we explicitly said those. So I just want to make sure we do that real quick. And I have it pulled up and I have my, the 60-page document on the other screen. But it was around the coherent, the goals were really around the coherent, it was around building towards a statewide vision for families and for early childhood, right? So it was really like, you must set a direction and move in that direction. It was as their core priorities. Another core priority, again, was building a unified and coherent system, right? So these are things that we share. The final priority that they talked about was around increasing parent choice. And that's not necessarily the language that we use in Vermont as much. But essentially, right, because it's around like the mix, but it really supports the mixed delivery system, right? Like meeting kids and families where they are, helping them meet, right? Creating and supporting and partnering with the variety of programs, right? That are going to meet children's and families' needs. And so we already do that, I think, or we already have like the intention and the bones of all of that, even if we're not perfect at that in Vermont. And so it's not a huge change for us, but that's another piece of it as well. It really emphasized the need to think through the different what different families need, and how to meet that variety of needs, and somewhat preferences from families, but really I think focus on what their needs are. So I wanted to highlight that. So when we get into the actual the projects that are around unifying fragmented elements into a coherent statewide system, we had 4 major buckets of work that we're doing there. So the first is universal pre-kindergarten alignment. This is something we know has been a priority, right, for the administration, for the legislature, for the field over the last several years. There's been, I think, with between like COVID and staff transitions and needing to focus on Act 76 implementation on the childcare side, and then that we know that we're at 10 years past when universal pre-kindergarten was passed in the state of Vermont, and it's time to look again, right? To really look at it and say, okay, what is working, what needs to be improved, and also get clarity on how are we doing this from what is the jobs of the state and state employees, whether or not they're at the Agency of Education or the Child Development Division. What is the role of the school districts in this system? And then what are the role of any of the entities that are providing pre-kindergarten education, whether those are community-based partners or those are public school-based partners? And how do we think about what level of community planning is needed to support what we want for kids, which is we really want all kids entering into kindergarten with a quality pre-kindergarten education experience, right? That is why Vermont passed universal pre-kindergarten. It's about the kids and the kids having that experience before they get to kindergarten, so they're ready to go. And that pre-kindergarten experience also provides that space to identify those kids that may need some additional supports, either in that pre-kindergarten experience or as they enter into kindergarten, right? And to develop those family relationships and begin that process. So we in this work, we're going to be the intention is to hire a consulting group to really work closely with Child Development Division and the Agency of Education to work through a work plan that is going to be looking at the overall structure, places where, to see where there's places where there's lack of clarity, overlap, where better alignment is needed, look at how we're resourcing things at the state level, at the school district level, hopefully getting into, so what does that mean relative to some of the funding? Some of this stuff is just following up on the recommendations that were in the pre-kindergarten education implementation committee that finished up submitted a report about a year ago. And then ideally to make some recommendations for how we want this to go. We know, especially in alignment with what's going to be happening with Act 73 and or whatever else happens this year with the legislature, in terms of how our sort of pre-K to 12 system continues to evolve. So that is actually hopefully is intense consulting with leadership within state agencies, and it written into it, and both and with the leadership's discussion. We really do want to make sure that there's spaces to have have a steering committee, have a group of people who are who are implementers of the program, to really provide insight and advice, and to do sort of the test assumptions, push on what the priorities need to be, provide feedback throughout that process. So and I'll say this once now, but it probably will apply to many of the projects. These are, in state government timelines, right? 11.5 months is not very long. And so, you know, we are going to have to push really hard to like get a request for proposals or bids like ready to go. Ideally in the next 2 or 3 weeks, have a relatively short like response time, have a relatively short and then hopefully have a relatively short contracting process. CDD is going to be taking that on. In this case, we're not going to like then try to subgrant to AOE and then AOE is going to like to then do the process, you know, like after that. But I just want to flag that's like, we're aware that that is a risk associated with any of these projects that involve consulting that aren't already like in motion. But we know this is like just the timing of this and the opportunity associated with this and the urgency of us getting this done is really important. So that's some of the thinking on pre-K for the as one of the unifying fragmented elements piece of it. Another piece is looking at the coordinated intake and referral, or coordinated screenings and referrals. And many people are familiar with this more from sort of Help Me Grow and Children's Integrated Services. And Morgan, do you want to speak to that one?
Yeah, I'm happy to do that. So, you know, one of the primary needs that families identified was still struggling to navigate services and identify who the point of contact is. How do we navigate it? Who do we, you know, what is the order of operations and getting access to services? And so, in the last preschool development grant, there was a study that was done by Mathematica to come in and really understand our current system of services. The findings from that are currently being written up into a report, and we use the kind of preliminary to say, okay, in this grant now, we really need to bring in all of the key partners. And it's not just Help Me Grow 211 and CIS, it's designated agencies, it's parent-child centers, it's right. There is this constellation of partners who have a role in the identification, the referral, and access to services and screening and all of those pieces. And that is still a challenge across, even though we're such a small state, there's so many moving pieces that the coordination and integration of those things is not beautiful right now. We have extremely long wait lists, timelines, all of that. So the priority for that one is we are hiring a contractor. This one won't be as difficult because we already have the contractors underway, but bringing folks in to say, okay, we need to bring all of these partners together to think critically about how we fix some of the challenges and reduce duplication and overlap and see it as a comprehensive system instead of competing services or competing, you know, for resources and how that is going to function. Because we do have some amazing work happening in each of the spaces. It's just about bringing them together and saying, okay, if we really believe that there is no wrong door for a family to enter services, how do we go from they made a phone call to now they are being screened and referred and accessed in the most seamless way possible? And what does that look like across the state? And the partners at Vermont Department of Health, so Elisa's team is really leading that scope of work in partnership with others. So a lot of you on this call will be engaged in steering committee stuff and just that work holistically. I think that is one of the key ways that we're really trying to, without saying the word disability and special healthcare needs and those things in the grant, how are we supporting the most vulnerable kids and families and those with disabilities and special healthcare needs moving from identification to access?
Thank you, Morgan. Okay, so that was number 2 in there. Number 3 under that priority 1 is around coordinated sort of mental health and behavioral supports. So in the last preschool development grant, there was, and this is going to be led by actually Department of Mental Health is going to be again engaging a consultant, but we know that in the last that there's a lot of let's see, I'll start at a different spot, which is where Morgan started, which is we know that children and families and programs, right, are needing a more robust system to support their like safe and productive inclusion within early childhood education spaces. And I think we've been in a place where people are, they've been trying out a lot of different approaches to sort of see what works. And so that means that has included like Department of Mental Health had some funds from last PDG funds, and they were working to build out the designated agencies capacity to do this for children's integrated services within specialized childcare. Right, there's like there's like a bucket. There's been a bucket of work to support programs within like the Seed and Sow work, right? Like that's also a part of it, and that was funded through the grant making part of Vermont Early Childhood Fund, some pieces of it, as well as through specialized childcare. So it's like there's the early MTSS work that is mostly led out of the Agency of Education. So that we've got all of these different approaches, and which may be fine, but we haven't like coordinated and identified what are the pathways and how do they work together, and how does a program know which one is the right one for them, and like how does a family get connected to the supports they need. So the intention is to look at what has been tried. It's not like we've been throwing spaghetti on the wall, because it's like much, I mean, if it was, it's like very good spaghetti, but it's like it's not all coordinated yet. So the goal is to figure out like how do we map that, make it coherent, figure out what we want to have be ready for
in a year,
additional continued investments. So that, Morgan,
but yes, Diane, nothing. I just was noting that Diane said in a year. Yes, like this. So we also fully recognize that we are putting out as much as possible, but
yeah. This one is definitely, it's a consultation project, right? It is the like, let's map what's already been done. Let's see what's been working. Let's take a little bit of a broader view of like, how are other states doing this? And like, try to make and get to a place where we're saying, this is the direction we want to go into, and have buy-in on that. Not necessarily that we're going to be able to implement it. It's going to be like, we're getting to the place of a shared agreement on how we think Vermont's model would ideally be working. So that's the
yes, absolutely, Diane.
okay. And then the final one under unified fragmented elements is around aligned pathways for the early childhood education workforce. And we have a number of different projects that were sort of combined under that one. And the key partners on that one are CDD, AOE, and Vermont AUIC. And for the
Can I add a
agency
couple more? Let me add a couple more, Janet, just because there are more, right? So it's also Head Start associations, the Head Start Collab Office, AOE, the Department of Labor, the Higher Ed Consortium, Northern Lights. Like I'm looking at you, Becky.
Okay.
Like this one is a little bit more robust.
Okay, fair enough. Okay, so so in terms of that, I mean, I think where we're at is that the Agency of Education is really interested in how are we supporting early childhood educator pathways. They are interested in how do they leverage some of the partnerships that they've had with the Department of Labor related to K-12 educators. And they also know that CDD and Vermont UIC have had a longstanding partnership on apprenticeship for educators sort of more on the earlier side of their career, typically sort of on the paraprofessional side, if you were thinking about it from a K-12 context. So again, I think this is, and they also are interested in what is it, you know, how can we support AOE educator licensure for people working within EC contexts across all of them, not just within public schools, which we know has been a challenge. So I think it's a great opportunity, and they have a staff member who is going to be dedicating, you know, a significant chunk of their time to this in the next year. And I think this one is going to be a really good opportunity for us to, again, right, integrate our fragmented elements of our system and at least really, and have those conversations. It also will support some of the continued workforce development work and piloting that is really Vermont UIC has been the lead on in terms of thinking through some of our higher education pathways, coordination with across higher education institutions, doing some of the outreach around EC careers to people that are considering EC careers or wanting to grow in their EC careers. And it will also include additional workforce analysis for us to be able to sort of, so that we can make sure that the programs that we're developing meet the needs or are focused on, those elements of the career pathway that we think really need them, where people need the most support. So I think that will be a great, I think you guys as a group are very likely to spend a decent amount of time looking into this and diving into that project, diving into that work overall.
Before Janet transitions, just a quick note, Ashley and all of you who are trying to take notes while we talk, please don't feel like you have to do that. We wanted to bring it to ELD as quickly as possible. This is hot off the presses. We didn't develop the one-pagers, the slide decks, all of the things that people really need to be able to follow this well and understand. So just naming, we didn't want to wait any longer to give you the kind of, here's the high level, what you need to know, but we will be doing the one, as much as we can on the communications, the one pagers, and here are all the ways to be engaged and all of those pieces too.
Mm-hmm. Yes. Sorry. Yeah. Mm-hmm. It was Jan. I think it was either the 29th or the 30th that we got the notification that we got the grant award. And it's like I got it on the 29th and the grant award literally starts on the 30th or something. I mean, it was okay.
Yeah. So we apologize for coming in super hot, but we wanted you to know and hear, and then we'll engage folks as well.
Yes. Okay. I'm going back and forth over my other screen between some of the notes that we have and the piece of it. I guess the other thing I just wanted to recognize too is there also is on the workforce development side of it, there is a focus on family childcare providers as well. So just want to emphasize that as well. And actually, I think there was some pretty exciting news already from Vermont UIC in terms of having a lot of family childcare educators excited to jump right into some additional, a cohort that's doing college level coursework together. And so, okay. Oh, I've got too many documents open. Morgan, what am I supposed to talk about next?
Workforce analysis.
Okay, I think I said that. Did I?
Okay. Then let's go on to priority 2. So expanding program availability and sustainability. And this is.
Yep. Okay. Great. Okay. Thank you. Yes. So this last one, right. We talked about it as building childcare capacity to serve all children or to serve, and this was one where we definitely were, it was great because a lot of this again was aligned with strategies that we've already implemented in Vermont. And so this is allowing us either to continue them at a really robust level and some places to expand them as well. We are, we definitely do have, you guys know that overall, right, we're anticipating we're in a tricky budget time, right? With especially Medicaid, SNAP cuts, right, are flowing into really tightening our human services budget in the state overall. And so this was really great to have some of this. So there is a little tiny bit of this that is us being strategic about we're going to use PDG, and then that's going to preserve some of our other federal funds, maybe into FY27 and things like that. But I think you guys will find, this work is pretty exciting. So it does include there's 4 strategies really under this. So one is the childcare business assistance and coaching. This is the work that First Children's Finance has already started, and this is going to allow First Children's Finance to continue that work and to to sort of strengthen and expand it. One of a couple of those things are related to strengthening their work around succession planning, and their tools that they have there. Another piece is related to the work on what was it? Oh, is related to, what do I have it down here? Sorry. Like the wider variety of partners that are working on childcare capacity in the state, and we're making sure we're building a table for those folks to come together. So what we know is that the Agency of Commerce and Community Development grants, we know that regional planning commissions or economic development coordinations or municipalities, right? They're like all starting to think about childcare capacity, but they don't, right now, it's like informal. Like, how do you hear about what's happening and what other people are doing? And you just call your neighbor, you know what I mean? You're like, oh, I heard about a cool program there, and you figure it out. And so the question is like, how can we build that into a more coherent structure? Help have some tools related to, like, this is the financing continuum that's available, that people know how to co-refer to what is the right, the other entity that can help them, with where they are in their journey. So that piece of it. So that's a couple of the strategies on capacity building. The other ones are, we packed a lot into this one. This is the biggest dollar amount one within the proposal, is related to just capacity building, right? Infant toddler capacity building grants, right? That is a piece of it. But also thinking about grants, we also framed it as grants that help programs to serve children with specialized developmental, behavioral, and medical needs. Some people might know those are special accommodation grants. So that funding is built into this as well. And we also have some funds in there to do some analysis and planning for the specialized childcare system as well. So doing programmatic and financial analysis of specialized childcare that hopefully will get us to a place of what are the next steps? Like, how do we refine, strengthen this system so that it works better for everybody, works better for families, but also works better from an administrative perspective as well. It's going to include transportation as well, which is tricky. Definitely going to include our Head Start and early Head Start partners. So that is what is in the one on childcare capacity to serve all children. Let's scroll down a little further. We also described another one as increasing family choice through childcare financial assistance, which is accurate. And but we have so essentially what we're doing though is we're using childcare financial assistance as our state match for this, because we had to have state match, and fortunately Vermont invests a significant amount of state dollars into childcare financial assistance, and we have that ready as state match because it's not been around long enough for it to already be matched 47 other ways. That's really the most of we're using childcare financial assistance as match. And then we also are planning to do a little bit more analysis related to childcare financial assistance and to think about, what are the improvements we need to do there as well. So to look at the CCFIP eligibility determination process, is there anything about how we do that should be, how can we look at that? What can we learn from talking to our, to the community childcare support agencies, right, that do eligibility for us, and think about what are the, what can be strengthened, what can be streamlined, how do we make sure that this is a really supportive experience for families, and also administratively, as administratively simple as we can make it for everybody involved, knowing, as everybody is seeing right now, that there is appears to be a federal focus right now on Child Care Development Fund dollars going to legitimate purposes. So that will also end up being a layer that we probably need to have, just so people know. Vermont does not have I didn't say this up, but Vermont is not one of the states that's been told they have a freeze We're being told we have a little bit of additional documentation that we need to submit when we do federal drawdowns. So that's sort of separate to the news, the big news that's happening around, or I guess the big noise that's happening around CCDF. It's not necessarily like that much news from our perspective, from Vermont's perspective specifically. Okay, so looking at that, and then also looking at CCFAP outreach and explainer material, right? So, right, we did do some marketing materials that said, come and get it. But we know we need additional materials that really explain the nuance of childcare financial, of CCFAP to families and to programs, right? Like we've got the FAQs and things like that, but we really want to strengthen those materials and make them as strong as possible for people so that it's more efficient for everybody. So, and people have the language they can use if they need it, or just a document they can refer people to. People can find that information themselves on our website if they need it. So continuing to develop out that piece on childcare financial assistance. And we are, STARS is also, as part of this, we talk about expanding access to high quality care through statewide quality improvement. So this is our STARS program. And because this is under the category of, increasing the, state capacity to serve all children, there was a real focus on having and using data. This effort is really, the application really focused on emphasizing the work that we're doing with STARS related to class assessments, right? So the external assessments, the external assessment database system. This proposal came in like a good moment of that rollout so that we're able, because we really are just getting to the place of having a class. The class system has to getting closer to full implementation, right? It was kind of, it's been ramping up, but now we're kind of at the ramp up. We have the database. We're going to be able to do the work, we think, at scale in the state and have the data within tools that are both going to help programs be able to use that information really well to improve their own practice, but also going to help the state understand what is happening in programs. What is the level of quality we're seeing? Where are the areas we need to strengthen our own training or supports, that kind of thing. So there's a lot of, there's a section on that piece of it. Let me just double check, but I don't, it is going to include, Don, I don't know if I have the update on this one, because I don't think I've seen that contract come through yet. Sorry. We should actually be moving to having a online STARS portfolio tool that will be much more user-friendly for people than what we have right now for the STARS application and review process. Believe we are finally to the finish lines on that one. That one got caught in a little bit of a bureaucratic, I don't know, like no man's land somehow, just a little Twilight Zone. Even though everybody kept trying to help. There were so many people trying to help move it forward, but it was just tricky. And then also parent education and outreach related to STARS. So also working on getting some of those materials. There's materials that were created related to parent education outreach for programs and for parents that are already in the works, but we didn't necessarily have as like online resources. But this would be able to allow us to extend them and allow us to have some more like print materials or things that programs can have out to explain what is happening with STARS, that families can understand. What does it mean when you're looking at STARS? Like, what are the things that the state's assessing? Like, from the perspective of them understanding, ideally, it's hopefully building their appreciation for what early childhood education really is, right? And the skilled work that's happening in the program that their children are spending their days in. It is quality improvement, but right, it is also just like parent education as for them to engage as partners with educators when their children are young, but hopefully you can help them as their kids get older as well. Okay. Sorry, it's still me, you guys, and it's 11:50. So Morgan, you just
You're good. You're good.
Okay. Sorry. Thanks, guys. Okay, this one thing to know. There's money for digitizing Vermont's criminal background check system to expand childcare availability in this. So we put $1 million in there. People may know we've had a multi-agency work group. This is this place where it's like we had the multi-agency work group. We've been working really hard on creating that shared vision between, Department of Public Safety, which provides the service, right, to CDD, AOE, but also Office of Professional Recognition, like other entities, right, that also need the background check service that, the Vermont Crime Information Center is the only entity within the state that is really approved to do the FBI checks that are required. So anyway, we're really excited. We got we got responses to this RFI with Agency of Digital Services. We didn't fall out of our chairs at the dollar amount. We think the amount we're getting through PDG is enough to make a really good go with it before the end of, in the next 11 months. And the Secretary of the Agency of Digital Services has promised to do every single thing she can to help move this one forward. So I'm really excited. I had a meeting yesterday with the governor's office, with ADS, with Department of Public Safety, with AOE, and we are hopefully, I think at this moment, the word is full speed ahead. We got the money, we got the plan. Let's see what we can do in a year.
We also really appreciate the continued, hey, here is where it's on fire in X, Y, and Z areas of the state. We understand that this is one of the top concerns. It's getting elevated to legislators, the governor's office, and everywhere. So just naming, yes, we are moving on it. That doesn't mean you shouldn't still say, hey, we need you to know in X, Y, and Z sector and let us know. But this one's a really big win because it also is allowing us to free up other state dollars potentially that we would have had to allocate towards this effort because we know that this needed to be a priority regardless.
And then keep going. Shared services for health and safety and childcare is in there. And there's 2 projects within that, which are, and one is, this is giving us funding to update our orientation modules that we have for childcare. And, right now we use Better Kid Care. We know that we needed to update those anyway for federal compliance reasons. Also, it's time, right? And we want to make sure that those are really strong and useful, and that I think we've just committed to a vendor. I don't think we've signed the agreement yet, so we can't see the name, but I think we're, that's going to come through. So again, this is a thing, it was already in the works. We were going to do it anyway, but we're like, here's a perfect spot for it. And also this also will include supporting the some of the work that the Family and Child Health within VDH has done related to safety consultation, and also some more additional supplies that was part of the last PDG grant. So but even within that work, we're really going to be saying, how do we bring that together, right? The point, it's about creating an integrated, coherent system. So it can't be one part of state government is off doing this other thing. It's going to be, if we're talking about health and safety within childcare, we need to, and the training and consultation that's needed, we need Family and Child Health there, but we also need CDD there. And that includes both childcare licensing and children integrated services. We probably need Northern Lights. We need Northern Lights there. We need, so we're going to try to use this as a moment to also say, let's circle up, because again, we don't know what's going to happen with PDG funds in the future. It's likely to actually end up being I heard yesterday that it's likely to end up being kind of an annual cycle because the federal funding stream is unknown or unclear right now. So trying to, again, use any of these projects to say, okay, let's pull it together, guys, and figure out a shared plan that's going to be really efficient, make sure we don't duplicate resources, but also aim to meet the needs of folks on the ground. Oh gosh. Okay.
Still you, sorry. Data
Sorry,
system.
it's okay.
We're almost done, though,
Sorry.
we promise.
We're almost done. Okay. Improving early. So the final, what did I say? Okay. Then the category 3 was align and share information and data system. Great, right? So we have the expand the child development division information system. This is still the work that we're doing to move childcare licensing out of BFIS and into CDDIS. We're in the final vendor selection phase on that. Some of the estimates came in a little higher than what the state had budgeted already, had like set aside for this project. So we put some money within PDG to continue that work forward. So it's nothing new. It's nothing that we haven't already been talking about for quite a long time. But it's some additional money given the new information that we have on some of the cost estimates. And that team is doing the final live vendor demos, I think today. So hopefully
I
they're
think
going to
I
get.
just heard them finish in the other room.
Okay, there you go. So hopefully we're at a selection real soon. And then, okay, and then it is, okay, children's integrated services. We were not at a place with that project to be ready to do like a full, like build in a full children integrated services data system into this grant, right? Like we were, so we weren't like we had to only put projects in this thing that were ready to like hit go on pretty much. So that part of it is not in there. What is in there is support for an overhaul of the children integrated services billing data system. So that will help with a good chunk of what the challenges have been related to children integrated services. Not for all of it, but for a specific chunk of it, it will help. It won't necessarily, that's not the case management piece of it, which some children integrated services partners are asking for, but it should really help and make the billing side of it more efficient for both our CIS partners as well as for the state, and also just create a much more reliable system that does not lose data, basically. So that is what's in there for that specific related to data for CIS. Okay, Morgan, back to you now.
The last on the integrating data sections that we're going to prioritize is Head Start data. So again, really intense focus on Head Start in this application. Head Start has their own systems for both capturing and summarizing reporting data. So what we're going to be doing is integrating the Head Start program information report, the PIR data, alongside the community needs assessment into Vermont's Early Childhood Data and Policy Center. So getting all of that data alongside the childcare data, the pre-K data, and the rest of the system. And then working with Head Starts on communicating about that data, because one of the things we've realized is folks in the state of Vermont actually don't know a lot about Head Start, what we do, how we serve kids, what it means, and what those outcomes are. And we recognize that folks are needing to jump off. So the thing that I'll leave you with in the last project or the last element of this entire grant is all about data. Tracking impact. How do we know if we're doing the right thing for kids and families in Vermont? And it is a very intensive scope of work where we're building systems in the first year to both track impact of the grant itself and each of the projects and what we're doing during the grant, but then also going to the strategic plan. And this is really where we're going to come to our planning committees, especially this group and data and evaluation and others, to say, what are those most important outcomes and process indicators that we need to be tracking to know whether or not we're making a difference, making sure that we have that data and that we are making it publicly available in meaningful ways. And that's both population level, but also what is the work that your teams are doing? How are you seeing change and doing the qualitative work there? This section also includes a lot on supply and demand analysis. So working with First Children's Finance, but also Vermont After School. So for those of you who haven't heard us talk as much about Vermont After School, we really are talking about a comprehensive system in a different way and thinking about how to support kids and families across early childhood education settings. So partnering with them as well. And then we're going to be doing just a ton of system level monitoring, really working with this group and our other strategic plan committees to say, okay, how do we know if we're making a difference in the lives of kids and families, help us understand it, and then how do we communicate it to both our partners in the fields, but also to the administration and to the legislature. So, Dawn, I know we're just over time, but thank you for letting us.
Yes, we're a minute over. My hope is that before the next meeting, we will have those materials that we can share out with the group, and that we anticipate at that point in the February meeting that we will most likely have some need for some question and answers as you digest this information. But it's super exciting. I really appreciate you staying over. I'm almost apologize for Morgan, to Morgan and Janet for trying to cram all of that into 1 hour. It was great. And I hope to see everyone next month. It'll be exciting, that one too. So thank you.
Bye all. Good to see you.